Welcome to Kismet Tech Talk, your monthly rendezvous with the latest in disinfection and antimicrobial technologies. I'm Dr. Christina Drake, your host for today's episode. Join us as we dive deep into the science, innovations, and applications shaping the future of clean and safe environments. All right, good afternoon, and welcome to Dr. Katie Flynn for joining us for this episode of Kismet Tech Talks. And so we are going to be talking today about everything equine biosecurity. And to kick things off, we would like for you to share a little bit about yourself so our audience can know who it is that's giving them information today.
Sure. Thanks for the opportunity to come on here today. My journey's been a little bit unique and unpredictable. However, I've always had a passion for horses, and my path to veterinary school and to this career path has been a little different. But it's all been based on my passion for horses, which started at a very young age. I actually grew up on a Standardbred racehorse farm in South Grafton, Massachusetts. And then I actually took the adventure to go to veterinary school in Glasgow, Scotland. And upon graduating, I actually entered a regulatory career field as a regulatory veterinarian for 23 years. 20 of those were with the California Department of Food and Agriculture. 3 years were with the Kentucky Department of Agriculture. In Kentucky, I was the state veterinarian, and in California, I was the equine veterinarian for the state. And now I recently took a position March of last year of 2023 with the U.S. Equestrian Federation as their equine health and biosecurity veterinarian. When you look at my actual path for biosecurity, it actually started when I was working for the California Department of Food and Agriculture. As I was in a position as equine staff veterinarian, I was responsible for managing disease outbreaks, quarantining, and I guess thankfully I've had a lot of experience there with over 40 equine herpes virus outbreaks and 40 or so equine infectious anemias and several contagious equine metritis outbreaks. And from all of those, I did learn a lot about disease spread and introduction and what we can do to control and mitigate these outbreaks. But actually, my turning point of my career was actually in 2011 when there was a large multi-state equine herpes virus 1 outbreak, which originated at the National Cutting Horse event in Ogden, Utah. However, it spread to about 19 states and several Canadian provinces. What happened, though, is in California, this caused the cancellation of several horse shows, and event managers had no guidance on how to determine if it was safe for their show to continue. So you had a cutting event that affected dressage shows, jumping shows, all different disciplines, because folks didn't have any guidance or information on how to decide if they should hold the show. So I was actually charged by my advisory committee in California to develop some type of tools for their decision-making process. So this actually started my biosecurity career path, as I like to call it. And it started really with me visiting about 40 horse show grounds in California to observe their biosecurity practices, specifically looking at how a disease might enter the venue and then spread on the venue grounds. So after I did these site visits, I actually compiled what we called the 2012 Biosecurity Toolkit for event managers so that they had tools and resources to utilize the next time there was an outbreak. And that toolkit has actually been used well across the United States as well as worldwide. And so since that time, I've used that toolkit and my interest to continue to pursue biosecurity. And I'm fortunate enough now that that is what my position is actually focused on, is biosecurity at equine events and utilizing my disease outbreak response and prevention expertise to help show management in the event of an outbreak.
Yeah, that is an impressive background for equine biosecurity. So since 2012 to 2024, what would you say is the, I don't know, top 1, 2, or 3 things in terms of things that have changed in equine biosecurity since when you first became a biosecurity expert to today?
Yeah, it's a great question. One of the biggest things I think I've seen as a change is we used to see a lot more communal water troughs at horse shows where horses could drink out of communal, one big water trough during the event. We learned that that is obviously a way to spread disease, especially any respiratory pathogens, especially EHV that can actually persist for about 21 days in a water trough. So over time, I've actually seen stables and horse show grounds decrease the number of communal water troughs to not having any at all. So that would be one really significant change. I've also seen a slower change, and it's a slower change in health monitoring, with more temperature monitoring of horses, and sometimes thinking about whether that horse should really go to a horse show if it's just not doing well. So there has been a little bit of an increase in looking at the health and monitoring the health of the horses before they go to the show, as well as go at the show themselves. And I will say that there's also been an increase of cleaning and disinfection of equipment. Not where we really want to see it, but we are starting to see folks think about how often they actually do clean and disinfect. However, I'm still seeing some of the higher risk factors, such as sharing of nose rags or things that they use to wipe one horse's nose and they use it on another horse. Obviously, that would be a concern for spreading respiratory pathogens.
Yeah, so still a ways to go in terms of really getting equine biosecurity up to where it needs to be. So we wanted to look at different factors that, to consider when thinking about equine biosecurity. I wanted to touch on international travel first. You'd mentioned, for shows. So, right, we have a lot of horses that come in and out of the US for those. And so I wanted to hear, domestic versus international travel, some of the concerns or trends there in terms of biosecurity.
Yeah, that's a great question. Traveling is definitely a concern, whether it's local or international. We actually are seeing a lot more horses traveling to these events and for further locations. When we look at increase in competitions, we're not even seeing an increase, not just in the United States, but we're seeing an increase internationally, which means we actually have a lot more horses from the United States traveling internationally for federally recognized or Federation Equestrian International, FEI recognized events overseas. We have almost 1,000 horses that are going and competing overseas each year. And so we have horses that are going to European countries, to Saudi Arabia, to the United Kingdom. So they're going all over the world. And every country has a different disease risk, that diseases that aren't present here in the United States, that we want to make sure we're not getting our horses getting exposed to. So the protocols that they have to follow when they go, make sure they're isolating and making sure they're following these protocols to best protect us. But it really is the key point for anybody traveling, whether it's a horse traveling to the local show or internationally, is ensuring the horse is healthy. So making sure the sick horse isn't getting on the trailer or getting on the airplane, that we are taking those temperatures twice a day and observing them for that clinical signs of disease, to also making sure they're current on their vaccinations. To compete in a USEF, a United States Equestrian Federation licensed event, all horses must be vaccinated for EHV and influenza within the prior 6 months. So again, vaccination helps, but they also have to do good biosecurity to best protect them. And when we talk about biosecurity, there's like 5 steps that we actually tell folks to think about. And if you follow these 5 steps, you're really protecting your horse. So if you limit your horse-to-horse contact on the ground, so no nose to nose, not getting close to other horses. If you limit the number of people that are contacting your horse to only the essential people and making sure they're not going from horse to petting them, so we're not spreading pathogens. The other thing, obviously, is we talked about it earlier, is avoiding the communal water. Again, making sure we're not sharing those water troughs. And lastly, if we're looking at it, is avoiding any equipment, including those nose rags, unless they've been cleaned and disinfected between uses of between horses. And most importantly, I think the critical step we have to think about, whether it's here or international, is we need to monitor those horses because they could be incubating something or they could be becoming sick at an event. So we really need to take their temperatures twice daily, log that temperature, and see if there's a rising trend in that temperature. And if it does hit 101.5 or higher Fahrenheit, or they are seeing clinical signs in those horses, they really need to get a veterinarian in to do some further examination and to make sure if that horse does have a potentially infectious disease, that that horse gets isolated appropriately. And so whether it's domestic or international, we can take steps to protect our horses, and it's essential that we do that.
Great advice, and this kind of segues into the next question I wanted to delve into. So emerging pathogen threats. I think people are more aware of that now with, we have COVID-19. So I think the world was shocked awake by that. But also, more minor emerging threats like monkeypox when that came out, 2 years ago. Obviously, these are human emerging pathogen threats. But in equine, from your perspective, what are the most pressing infection diseases that are affecting horses today? And what do you think are the best ways within the equine industry to really manage those?
Yeah, that's a great question. We are seeing different emerging pathogens, whether it's the human or horse world. We have our standard pathogens that we always see in the horse world that can be changing. Similar like the influenza in people, influenza in horses, we have different modifications to that virus. So if I look at the most common equine infectious diseases in the equine world, we're looking really at those respiratory pathogens as they're easily spread from horse to horse, especially when you have traveling horses. So we're looking at equine herpes virus, which is a respiratory virus, but it also can cause neurologic disease or abortion in the pregnant mare. We're also looking at equine influenza virus or equine strangles, streptococcus bacteria. Those are very common respiratory pathogens and again, at a risk for horses to get exposed at a venue, whether it's a horse that's silently shedding these pathogens or a horse that's sick, but we're not really seeing overt clinical signs, just a fever that might not be detected. Then the other thing we have to think about is some of these vector-borne diseases. We're looking at mosquitoes that are out in the population, especially if there's standing water at a venue or a lake or something that's near there. We really have to think about what are those diseases that can be transmitted by mosquitoes. So those would be like Eastern equine encephalitis or West Nile virus, depending on the prevalence in the area. The good news about these that I've just mentioned is we do have vaccination that can help protect them from more severe clinical signs, remembering that it's not going to completely prevent them from being sick, meaning that the horses can still show clinical signs when they're exposed to the pathogen, even if they're vaccinated. But that vaccination really does help reduce the severity of clinical signs. And it also helps to reduce the amount of pathogen that might be shed from the horse. So we're decreasing that virus or bacteria that's in the environment. So we're exposing less horses. But if we look at that, vaccination is just one step, as I mentioned before. It really comes down to identifying that sick horse and immediately isolating it so that it's not exposing other horses. And then once that horse has been isolated, to ensure that the stabling area or the equipment that it's been in contact with, that it's all properly cleaned and disinfected prior to using it on another horse or placing another horse in that stall. So really, those are our focuses when we talk about pathogens that are going to be our risk pathogens when we are commingling horses.
Great. So another segue, cleaning and disinfecting, which doesn't really deal with the issue of mosquitoes or insect-borne disease, but definitely for surface transmission, especially in show facilities. So when you're working with equine facilities and talking to them about their biosecurity protocols, What are some of the main challenges that you see those facilities facing? And do you feel they have proper protocols in place? And I guess based on those deficiencies, the U.S. Equine Federation, what are they focusing on to help those facilities really get sort of to a baseline, at least within the U.S. when it comes to equine biosecurity?
Yeah, all great questions. So since I started here with the U.S. Equestrian Federation, one of my roles is to visit the facilities across the country to kind of identify what are some of our challenges that are out there. One thing to keep in mind is every facility has its unique challenges, whether it's the different horses that are coming in from different geographic areas, or the facility design, whether the stalls are made of cement or the stalls are made of wood. So each facility has their own challenges, and you can't say one size fits all when you look at a biosecurity plan or a cleaning and disinfection plan. And each venue, no matter what, is different, and even regional differences. I've been to just this year, I've been everywhere from California to Nevada to Colorado to Florida to Kentucky to New York. And each of those, whether you're going to California to Florida, they have temperature differences, they have humidity differences. And those facilities, unfortunately, are built for human convenience. And why is that unfortunate? It means that we're putting stables and we're putting horses in close proximity. They're sharing the same airspace and they're very close, whether it's in the stabling area or the competition area. So this is actually increasing the potential for horse-to-horse contact or respiratory spread of pathogens. So that's one of the things you look at when you go to a facility to look at one of their challenges. And it's first looking at how is their facility designed and what steps can we take to limit the horse-to-horse contact or decrease the respiratory spread. The next challenge I see at a lot of facilities, once I look through the design, I look at where is their isolation? Where are they able to isolate sick horses? Because it really should be as far away as possible. Unfortunately, many times the venues only have one or two stalls left in the end of a barn, and they're saying those are going to be their isolation. Well, that's not really separating the sick horses from your competition population. So that becomes a challenge, is where do you put that sick horse and how do you isolate that sick horse? And other times they may have put it in a separate barn, but they're putting it on a path that all the horses have to walk through or all the humans have to walk by. So again, increasing our risk for spread. So unfortunately, we have to look at where is the best place to isolate these horses and look at what does the facility have? Do we have to set up a round pen in the middle of a parking lot so that it is secure and away from everything and put up a temporary stall out there? So that's the second challenge that I see is the area to isolate a sick horse. And then, another challenge is looking at how is that stable constructed? Going back to the wood versus cement. Is the wood a chewed wood surface, meaning that it's got a lot of corrugation and where bacteria and viruses can go to hide? Horses like to chew on the wood and they're going to keep damaging it. So how do we prevent those pathogens from hiding? Horses also like to dig at the walls, dig at the floors, and what are they doing to those surfaces as far as pathogens? So really, when we look at that, those would be the three areas: is stall construction, facility design, and isolation areas. Looking at that and how can we address those? And the first thing the USEF is doing here is we are requiring shows to have an isolation plan that is written and reviewed by us so that that isolation is in place if there is a sick horse so that we can immediately remove that sick horse. Like I said, additionally, I'm looking at going to facilities across the US and I'm looking at what are those biosecurity risks that we need to address. Again, making sure that each facility understands their uniqueness and what they may be exposed to and what their issues are. Lastly, here at the USEF, we're looking at, we developed some videos on biosecurity for both the competitors and competition management, looking at biosecurity before the show, biosecurity during the show, and biosecurity after the show. making sure that we address all three. So not only are we protecting the horses at the show, but the horses back home once they are leaving the facility. We also are working on, we developed some videos on competition management for how do they not only develop an isolation plan, but how do they implement it if there's a sick horse? So it walks them through the steps of looking for an appropriate isolation area, looking for how to move that sick horse to that isolation area. And more recently, we actually released a series of videos on proper cleaning and disinfection protocols. I think the biggest concern I see out there is people are cleaning and may leave some dirt behind, and then they're using a product that is deactivated by some dirt and manure because it doesn't work in the presence of an organic material. So really looking at making sure they do all the steps of cleaning and all the steps of disinfection. And all of these materials that I just mentioned, as far as our videos, and we also have some brochures, they can all be found on our USEF website, usef.org.
Great. Yeah, that's all really great advice. It's amazing how much equine biosecurity mirrors just like human health and the precautions we take, but we tend to not think about that as much in the animal space. So when it comes to cleaning and disinfecting, so this is a multi-part question, but I wanted to get your take on, as your role as a veterinarian, how you feel facilities are doing with that um, in terms of cleaning and disinfecting and preparing for shows. But then also, quaternary ammonium compounds have been a popular disinfectant in the US over the last 40, 50 years. In the viral space, not always as effective, especially against emerging viral threats when it comes to, just the reduction and spread of disease. And so just kind of curious, when it comes to cleaning and disinfecting, what kind of protocols and what type of broader efficacy do you recommend facilities look for when they are evaluating, cleaning and disinfection as part of their biosecurity plan?
Yeah, great question. All about cleaning and disinfection of the facilities. That is the biggest challenge. And the reason it's a really big challenge for our equine event facilities is they usually have shows week after week, and they have very short turnaround times for cleaning and disinfecting the stalls. In some cases, they do their best just to remove the organic material, and they may quickly apply a disinfectant. And that disinfectant may not have the contact time it needs. It may dry out before that contact time, or they may be applying a disinfectant to some of the organic material and it's not working. And as I said before, some of these stalls can't be cleaned as appropriately as they need to be because they're wood stalls and they're not sealed and they have a corrugated surface. So they have much areas where the viruses and bacteria can hide out. And so without the complete removal of that organic material, that disinfectant is not going to have that efficacy. And if the bacteria is hiding and you're not able to access it with the disinfectant, you're going to again have reduced efficacy and again increasing the risk for pathogens to remain on the surface and expose horses to a disease risk. From the USES perspective, we actually are recommending, complete cleaning of the stalls, and that is complete removal of all the debris. And one of the things we really put an emphasis on is we really need to see them remove the manure stains. And that is going to take a detergent, something that can penetrate that surface to kind of bring up those hard stains that are hard to get off, where pathogens could be hiding. Personally, I've seen a lot of benefit in Dawn Power Wash. They actually can it's a foam, it gets foamy and it can actually pull those caked on organic materials up. And once it's rinsed off, we're able to get at those manure stains. So we're really focusing on the cleaning side of things. from that perspective of making sure it's clean. And then we're focusing on making sure you're choosing the appropriate disinfectant and making sure you read the label for what's the type of surface that disinfectant can be used on. Because if it's a metal bars, you don't want something that's corrosive to metal. And again, if we're looking at the wood stalls, our recommendation is using some type of sealant, like a polyurethane that can be applied over the top. And then once it's sealed, then applying the disinfectant. Again, cleaning is the most important part, and that's what we're putting the emphasis on, to make sure it's thoroughly cleaned before applying the appropriate disinfectant. And then once the disinfectant is chosen, making sure they follow the label instructions for not just for the concentration that's going to be needed for the surface, but also the contact time to make sure that is the surface remains wet with that disinfectant for the entire contact time.
Right. And it's interesting, you're talking about different types of materials that make wood stalls. And it's interesting because in healthcare, in, US hospitals, there's a lot of focus now on the built environment and the types of materials that are selected, because not all disinfectants work on all types of surfaces, even if they're, hard surfaces. So I wanted to talk a little bit more about, the struggle with disinfecting stalls that are made of wood. You touched on that, but just for anyone that has a wood stall that might be listening to this, just to give them some pointers on what to do with that. And then also, just does the U.S. Equine Federation have a recommendation, on best type of stall materials that, like if you're building a new barn or replacing, a stall wall, what should, show facilities really be looking at when thinking about that?
Yeah, wood is definitely the most challenging type of stall to clean and disinfect. Number one, it does have the porous surface. It's just naturally, going to lead to that. It's also a surface that the horses can chew on, so that leads to more damage to the wood and more areas for the pathogens to penetrate. So we definitely, for those barns that are already built and they already have wood and we're not replacing them, we definitely recommend that they be thoroughly cleaned and scrubbed completely dried, and then the sealant applied. And once the sealant's been applied, then we can go back and apply a disinfectant, and it's going to be easier to clean and disinfect in the future. As far as a position on best practices for getting stalls onto the grounds, we have a lot of shows that are bringing in temporary stalls, and they bring temporary stalls in from numerous different companies. So we strongly recommend that they know the disinfection and cleaning processes that the company is using. And if those are being brought on, that they inspect them when they arrive to make sure that they are thoroughly cleaned and disinfected before their show begins. If they are looking to build a new facility, we will be happy to consult with them, depending upon the the weather in their area, and if they're going to do an enclosed barn versus a barn that's open to the external elements. There's different things that we recommend based on the design that they're intending, from that perspective.
Right. And so, just in the 12 to 13 years that you've, really focused on equine biosecurity, I know you've seen changes over that time period. And so, looking forward, what innovative technologies or approaches do you see being adopted that you think will actually improve equine health and welfare and really take biosecurity for equine to the next level?
Yeah, another great question. From an equine health perspective, I'm extremely excited about the advances we're seeing in technology for monitoring the horse's health. One of the recent advances is the biothermal microchip, or temperature sensing microchip, and they can be associated with your health records. There's apps out there now that are going to take the daily temperature recording from microchip once it's scanned, and they're going to link it to a health record for the horse. And linking that health record is extremely important because we can allow for temperature tracking, and we get advanced warning as temperatures start rising in these horses, and it could be indicative of some type of infectious disease. So that for me is really a really great thing that's going to be available, and encouraging folks to use that now, because that's an electronic system. They can keep their health records, such as their vaccinations, veterinary treatments, any tests that have been done on that horse. But it also allows for that health monitoring perspective when they add in the temperature. So it's a biothermal chip that there's an app that goes with it, and that app can do a lot of great things for health monitoring. So that's definitely from the equine side and what technology is out there. From the stalls and the temporary stabling side of things, we are actually seeing advances in the design of these temporary stalls to allow for better ventilation. Also seeing a lot more solid walls with a disinfectable surface. This is, again, great because we don't have nose-to-nose contact with the older stalls that used to have bars on half of them, so horses could have nose-to-nose. So great design and structure now, making them smaller units. Instead of 100 stalls, we're looking at 20 stalls. So if there was an exposure, it's a limited number of horses. So really looking at stall design and structure of those stalls, there's a lot of great advances going forward in that area. When we look at cleaning and disinfecting, we're actually seeing more products and equipment being brought into the equine world from the human side of things, whether it's a disinfectant product or technologies or equipment that can be utilized to apply the disinfectants. We have seen actually in the recent years some of our equine facilities using electrostatic sprayers to enhance application of the disinfectant around the metal bars in stables, because again, that's a hard area to reach all aspects of it with a standard application of spraying a disinfectant. So I'm really excited to see what comes of additional disinfection products and mechanisms for use, especially in larger facilities and large venues. And I'm also excited. We're seeing a lot of advances in diagnostic technologies, specifically for our equine infectious diseases. We have a lot of development going into stall side testing equipment. It's going to be a huge benefit if we had stall side testing equipment for equine infectious diseases at the competition, because competitions happen on a weekend. Labs are typically closed on a weekend. So if we could have some stall side test that would give us at least some screening information that we could follow up with a later diagnostics, it would be great. So a quick screening and says, yep, this horse has got something of concern, or maybe let's put it in isolation. So that's going to be a really great advances as we see more and more technology help us on the health care and monitoring side.
Really great information, really great advice for our fast four-legged friends that, go and travel to these shows. So for anyone who didn't catch it, listening to the podcast, where can they find information either directly from you on, web, socials, or from, the U.S. Equine Federation? And we'll post those later on too, so people can find them. But if you don't mind just telling people where they can find more information.
Yeah. For more information, you can actually visit the U.S. Equestrian Federation, Equine Health and Biosecurity. We can actually Google that. It's www.usef.org. And if you want to put in the search bar, biosecurity, they'll bring you to our biosecurity page. Or you can email me at kflynn@usef.org.
Well, great. Thank you so much for your time today, Dr. Flynn. And here's to biosecurity increasing in the next decade and keeping, our fast four-legged friends, fast and running.
Thank you.
Right.
I appreciate the opportunity.
All right. Thank you. That's all for today's episode of Kismet Tech Talk. We hope you found our discussions insightful and inspiring. If you enjoyed today's show, be sure to subscribe to Kismet Tech Talk on your favorite podcast platform to stay updated on all our future episodes, and follow our main social media pages by searching for Kismet Technologies. Remember, knowledge is the key to creating cleaner and safer environments for all. Until next time, this is Dr. Christina Drake signing off. Stay curious, stay informed, and stay safe.